So we have to place the hand like this, right? Right. So just either like this or like this or like this, very it's not very tight as well. Be calm, cool, right? So we need to place something is under the arm, pillow, something like that. You just place the first finger to be known as the index finger. So you just place on the first pulse to be known as a superficial pulse. The first pulse to be known as a superficial pulse. So this is the Renmai. Forget about the Renmai, Dumai. So Renmai, Dumai you will get here, but we need not to check. So he do have I can feel the pulses of the Renmai, Dumai partially, but we need not to consider that which is the international standard, globally recognized level we would like to see. First we have to place the first finger to be known as the index finger on the skin surface level. So naturally what you should do, the yang pulses try to find out. If the yang pulses are good, then the most of the times in pulses also good. Right? That's the reason first try to analyze only the fu viscera. If the fu viscera having the problem, then go to the deeper level to understand. Right? You just place like this. If your finger is good, if the sensitiveness or the resistance is there, that means you cannot feel anything, numbness is there in the hand, so that time you shouldn't touch with the fingers. If the numbness is there, you cannot execute them. But hopefully we understand. We just am placing as the index finger on the superficial pulse. This pulse to be left hand. This is the left hand. That means is the small intestine. Then I may feel or may not feel. You always keep it one book next to you, paper and then pen with you. Then you write down SI on my left hand and the right hand. You just mention like this. The left hand is small intestine having the deficiency. Then I just move to the next level. Yes, gallbladder. Yes, having the good pulse. Then I come to the next level. Yes, UB meridian is having the enough energy. No, I just got it the 3 pulses, right? So now I just, before going to the middle pulse, I don't want to make them to confuse. Middle pulse you forget as of now, then go for the deeper level.
Sir, can you mark those 3 with a pen, like where exactly you're checking the pulse, so that we can understand the like how much gap we are supposed to give?
Yes, exactly. I'll do that. Yeah, I'll do that right now. Then I'm just touching to the superficial pulse. Then I'm going to the deeper level pulse. That pulse to be known as a heart pulse. Then I'm just touching to this second pulse. Then going to the deep pulse to be known as a liver pulse. Then going to the Sh level, that to be known as a urinary bladder and then kidney pulse. Now I analyzed the 3 to 3 segments. Here I can find SI is deficiency, right? I'll see on the other hand, just placing on the surface level, large intestine pulse. Yes, I can feel the large intestine pulse partially. Then I go to the stomach pulse. Stomach pulse also I feel lesser than the normal energy. Then I'm going to the deeper, third level is the triple warmer. So if I am confusion or the patient is giving the confusion statement to me, then I reanalyze with the same pulses once again. Then I can find here is the stomach pulse is deficiency, triple warmer pulse is deficiency. So whenever we are the newcomers, so that time always you note down on the paper or the book, you keep it always is the ledger with you, then you just note down which is the deficiency of the respective person. Then you just note down, yes, SI is deficiency, stomach is deficiency, and Sanjo is deficiency. How to analyze if you are in confusion mode? Sir, how we need to understand where the pulse positions are existing? In that way, you just lift the hand upward direction. So this direction, it gives the knowledge about the three things. One is the heaven, the second one is the human, third one is earth. Heaven, human, earth. These are the principles, but these principles to be implemented to the human system. Now you just lift upward direction, then there are the three jios known as a heaven to be known as a upper jio, middle jio, human to be known as a human, then third lower jio to be known as a earth. So in this way the heaven, lower jio, upper geo, middle geo, then lower geo. These are the three segments are existing. So these are the three segments are divided into three different places on the wrist region. Baito Yunus bhai, unko bithaiye. So these are the three divisions we can find. So in these three divisions, upper geo related to the heaven, middle geo to the human, lower geo to be known as the earth. So in this perspective, then the upper geo, this is from the REN 17 to the top of the head. From the REN 17 to top of the head. What are the organs are existing? Yes, majorly the upper geo, cardiac system, of course is the pulmonary system. Then you understand this is the upper segment to be known as a, right side and left side get differs. Left side is the cardiac system, right side to be known as a pulmonary system. Yes or no? Then are you clear about the first segment? So, sir, why do we get the problem only on the lungs is right side, left side is the heart? Of course, because the heart is upper geo. You understand, if you are thinking that the heart is connected to the right as well, that also correct. If you are thinking the left side is the heart, that also correct. Please don't make the noise. Please mute yourself. So hopefully you understand is the first segment. The second segment to be known as a middle cavity. Upper is completed, now is known as a middle cavity. If the middle cavity, what are the organs are existing? Yes, of course. The right side to be known as a spleen, the left side to be known as a liver. Because as per the portal vein is connected to the liver system on the left side, so therefore it is the left side more predominantly, liver is affected on the left side of the pulse. After the middle pulse, lower geo below the navel, REN 17 to the REN 9 to be known as a middle geo, REN 17 to the Huyin or the Yungchuan K1 that totally connected to the lower geo, that to be known as a renal system, and of course is the intestines are existing. Then you understand on the third pulse to be known as a third pulse on the right side to be known as a kidney yang, then the left side to be known as a kidney in. Sir, how we do understand about the kidney yang, also to be known as a pericardium, kidney in to be known as a is the kidney, original kidney. So therefore we understand the upper geo, upper segment of the pulse to be known as a upper geo, then the middle segment or the Kuan. This will be one question in your examination, which is the Kuan pulse, which is existing on the styloid process, that to be known as a GUAN, Kuan pulse. So that to be known as a middle pulse. Middle pulse are governing to the middle cavity. Then the lower pulse to be known as a lower geo, that is connecting to the intestine and also related to the renal system. Right? So in this way you understand if the pulses are deficiency upper, you make them to understand yes, it is related to the brain related issues, also connected to the pulmonary system and cardiac system. If the middle geo is affected in this way, now we understand only the Zhang viscera. If we think about the Fu viscera, it is the paid organ. You understand, You understand, connected to the lungs is connected to the colon. Of course, in this way we try to understand. Lungs is connected to the large intestine. Therefore, the first pulse we will going to see is large intestine. The first pulses normally we would like to see only the fu viscera is, so we will try to analyze in the one more time. So just you place ವಿಶ್ವನಾಥನ್ ಸರ್ ಬನ್ನಿ ಒಂದು ನಿಮಿಷ ನಿಂತ್ಕೊಳ್ಳಿ, ಒಂದು ನಿಮಿಷ ಇರಿ, ಇಲ್ಲಾಂದರೆ ಚೇರ್ ಹಾಕೊಂಡು ಕುತ್ಕೊಳ್ಳಿ, ಇಲ್ಲಿ ಕುತ್ಕೊಳ್ಳಿ ಸರ್, ಪರವಾಗಿಲ್ಲ ಕುತ್ಕೊಳ್ಳಿ. So once we place like this is the upper level, try to find out is only the fu viscera, try to find out that the pulse is deficiency or excessiveness. Only see rhythm pulse, knotted pulse, slippery pulse, and then rapid pulse, accelerated pulse, no slow pulse, rapid pulse or deep pulses, or the superficial pulses or intermittent pulses, so on. But what is required? Only two things without making the confusion each other. You try to understand chi is existing or may not existing. Is the deficiency or there is a emptiness? Empty or it's normal. Two only need to be understand, that it gives the immense knowledge about the initial stages, whether it is existing or not, that particular pulse. If you need to place it small intestine is deficiency, then cross check with the you okay?
I'm okay.
Right. So we will cross check whether the SI deficiency having anywhere is the problem. In that way we will try to analyze. And also there is an important key component. So pulse rate to be known as a per minute is how many beats? 70 to 80. 70 to 80 or 60 to 80, 60 to 90 maximum, that range. If the less than 60 rate, that to be known as a slow rate or the cold constitution of the body. If the greater than 90 the pulse beat is there, that to be indicating is the rapid or accelerated pulse, that indicating the excessive heat is there in the body. Heat there in the body, and also heat is there on that particular organ as well. Yes or no? That organ and also particular in the whole body we can understand. So in this way, so I think somebody told that you mark it.
Sir,
so
mark the pulses, sir.
yeah, certainly. So now I'll try to see where is the wrist crease. So wrist crease, there are the 2-3 creases are there. Once you place the hand, then just distal to the wrist bone. Just distal to the wrist bone. Don't consider where is the crease and then marks which may not be understand. But just you give the pressure where you just understand there is the distal. Distal means is the below to the bone, to be known as the first pulse. So from here, this is the wrist crease. From the wrist crease, this is the first pulse. Then this is the second pulse, and this is the third pulse. Now we need to place, there are the 3 fingers at a time. If somebody wanted to use as this is 1, 2, 3 pulses at a time, we can place it is the index finger, middle finger, ring finger. So on the other hand, we just place it 3 fingers, 1, 2, 3 together. So this is in fact in the initial stages, even the single pulse registering in your mind having the dilemma, then placing the 12 pulses at a time, that will be great difficult. Perhaps it may take the decades together to understand. That's the reason initially you just see the 1 by 1 pulses and then note down. So you can have a look. This is the crease. The first line which I have mentioned, that is the wrist crease. Then after the next crease, the pulse to be known as a radial pulse. Why we should see on the radial pulse? Because it is the only the artery which is a superficial artery in the body is existing is the radial artery, which is easily accessible. If the carotid artery, the girls or the women, we cannot palpate here. The femoral artery we cannot palpate over this region. Dorsalis pedis artery which is existing on the foot region, also not so good. So that's the reason this the radial artery is the most superficial, and also it gives the immense knowledge. But each and every artery also it gives the information about the internal organs, whereas in the Huangdi and Nijing and Su and Chipo recognized as this system is the more good than the other system. But each and every artery it gives the knowledge about the internal artery. Whenever there is a etiology, pathology, disease patterns are existing inside our body system, that pop-ups on the radial artery, it reflects on the tongue diagnosis, it reflects on the facial region, so and so on. It reflects on the abdominal region as well. So hopefully you understand. But here also I just mark it. All are you, what is required? So whether it is existing, the pulse may not be existing. Only the two analysis is required in the initial stages. Don't consider there are the pulses which is required. So you just have a look. So these are the three different positions. I think we can show appropriately, yeah, to them. So in the Zoom, have any doubts on it to understand about the exactly where exactly there is the pulse positions are existing, but nothing to worry. Even I used to see the pulse still here. You mean to say till on the forearm? I used to see, analyze the pulses. Is what quality of the pulses are existing?
Sir, what about in the normal position, if the pulse is not there, little bit in the misplaced to other side or this side, is it okay?
Yes, if we will get the changes of the pulses, ಸ್ವಲ್ಪ ಈ ಕಡೆ ಆ ಕಡೆ ಹೋಗ್ಬಿಟ್ರೆ ಪರವಾಗಿಲ್ವಾ, but no problem. But you can find out there are the three different pulse positions, you just place it, but nothing to worry. But place it on the same places, that would be better.